So One Great Community is the community engagement component of a larger grant initiative at UAB, at University of Alabama at Birmingham, titled the CTSA, which is a part of the NIH enterprise. CTSA stands for Clinical and Translational Science Award, and there are 62 institutions across the country that have those fundings, have that funding, and UAB, where I am, is one of those places. One Great Community's real role and mission is to involve communities in how research is done, not just as study participants, but also as informers and influencers of what we study, what questions are asked, how those questions are answered, who's at the table to help address that. That's what One Great Community does. I think sometimes those of us who are in public health and who do public health research, we sometimes it's because there's so many issues that one could address in a particular study, whatever it is. If you're looking at diabetes in a population, or if you're looking at the disease progression of cancer with, across the spectrum, if you're doing bench science, for instance, I think sometimes the lines are blurred, and in public health we have a tendency to we want to do a lot of things when we may sometimes need to pull from the medical model and just focus on what it is that we really do know how to do, and address the issues that we are comfortable working in. Public health is such a big field, and everything is public health. So really trying to, I think, particularly when it comes to training young professionals and those who are going to go out into the field, be it boots on the ground, be it a researcher, be it running a health department or whatever. Number one, understanding what public health is. It's a lot of things. But at the end of the day, what we're trying to do is just impact health, community's health.